Good afternoon. Once again, Dr. Yakub Ibrahim is my name, Wildlife Hospital, Abuja. Today we shall be talking about one other health condition called pneumonia. Sure, a lot of us have heard about pneumonia, but what I do know from our interaction with people is that it's not everybody that understands what pneumonia is. Because sometimes we hear people talking about things that could cause pneumonia that we know that are not necessarily causative agents for pneumonia. So I'm going to clarify, we're going to talk about pneumonia, we'll look at what are the causes, what are the normal usual causes for pneumonia, and how do we feel when we have pneumonia, and then probably talk about how we treat pneumonia. Well, basically pneumonia is an infection that affects the lungs. It's an infection that affects the lungs. So specifically, now the respiratory system in the human body consists of various parts. We have what we call the upper respiratory tract, and we have the lower respiratory tract. The upper respiratory tract consists of your nose, your throat, and then part of the windpipe. The lower respiratory tract is the lower part of the windpipe, what we call the trachea and bronchia, as well as the lungs themselves. So pneumonia specifically means the infection has hit the lungs. It's not the upper part of the respiratory tract. So even if you are coughing and the cough is coming from a sore throat, for instance, that does not translate to pneumonia. Or you have a common cold and you have sneezing, you have whatever it is, even if it comes with fever, that does not translate to pneumonia. Pneumonia only arises when the lowermost part of the respiratory tract, which is the lungs themselves, are affected by the organisms. And various types of organisms can cause pneumonia. We can have bacteria causing pneumonia, we can have viruses causing pneumonia, we even have fungal pneumonia and sometimes parasitic pneumonia. But generally speaking, the commonest forms of pneumonia come from bacteria, viruses, and then in people whose immune system is a bit compromised for whatever reasons, you may have pneumonia from fungal infections as well. But the commonest forms of pneumonia we see are those ones caused by bacteria and then sometimes viruses. How do we contract this? Usually, pneumonia is contracted so when we inhale the organism, of however the organism is able to go through the respiratory tract and get to settle in the lungs, and then the immune system reacts to the presence of those organisms. Then pneumonia comes about. What do we feel when we have pneumonia? Usually it comes with cough, fever, chest pain. In most cases, when you cough and the cough is due to pneumonia, it's a chesty cough, and most of the times you may produce sputum or mucus that is coming from the lungs as a result of the inflammation or infection within the lung space. Let me say this, that we hear people saying cold can cause pneumonia. Is not directly true. AC does not cause pneumonia. Exposure to fan does not cause pneumonia. Exposure to cold weather does not cause pneumonia. However, the possible relationship or link between pneumonia and cold is where perhaps you have viral infections. Viruses tend to thrive a lot in cold environment. And so if you have cold, the temperature is low, viruses are more likely to thrive. And in most cases, those viruses will usually start from the upper part of the respiratory tract, in which case you may have a common cold. If the common cold, the virus that is causing that common cold has a way of finds its way all the way down to the lungs, maybe then it could cause a viral pneumonia. But generally speaking, it is not cold or fan that causes pneumonia. It's organisms that cause pneumonia. But certain weather conditions may allow some organisms like viruses to thrive better, and therefore perhaps increase your risk of contracting those viruses and then maybe pneumonia from there. But please, let's take note, it is not the weather that causes pneumonia, rather it's the organisms that cause pneumonia. Now, usually when we have pneumonia, of course, you by yourself as an individual, you may not be able to differentiate cough, for instance, coming from pneumonia or cough from allergies and cough from any other thing, for instance. So the best thing to do when you suspect that you have a pneumonia is to go to a hospital. The doctor's responsibility is to check you and differentiate and be sure that this cough of yours is most likely coming from pneumonia and not from maybe tonsils, for instance, or any other form of respiratory tract infection like bronchitis or even asthma, for that matter. There are other things that can cause cough, but not necessarily pneumonia. But doctors have a way of differentiating all of this. And that is why it's almost always not appropriate for you to call a doctor or a healthcare giver and say, I have a cough, prescribe medications for you. The best thing is usually, because there are so many things that can cause cough which sound similar. So the best way for a doctor or any healthcare giver to differentiate between cough of pneumonia, for instance, from cough of asthma, it's for the doctor to examine you. It's only when he or she examines you, you'll be able to know that this cough is most likely due to pneumonia and this cough is due to asthma. Now, when the doctor makes the diagnosis, usually the treatment becomes easier. Where coughs persist and it is due to pneumonia and it's not properly diagnosed, it can actually cause so many other complications, including fluid in the lungs and all of that. And sometimes it can spread from the lungs to other parts of the body and cause septicemia. So by and large, pneumonia, as it is, it's caused by organisms, not by weather. And when you suspect you have pneumonia, it's important you approach your healthcare givers, let them make the appropriate diagnosis to save you from any complications that can come from pneumonia. Thank you.